Hello everyone, welcome to sqadia.com, and now we are on section 5 of our lecture topic, methods of contraception. In this section we will talk about emergency contraception and sterilization. So emergency contraception is used in emergency when sexual intercourse occur without any protection. This can prevent conception. The other method is sterilization. We will talk about sterilization method, which are of two types: vasectomy for males and tubal ligation for females. And then we will talk about the complications of both emergency and sterilization methods of contraception. So emergency contraception, it prevents the pregnancy after sexual intercourse. This is also known as morning after or day after pill. This is used up to 5 days after the sex. A patient can use it effectively, but after that, it's no longer effective. So within 5 days after unprotected sex, emergency pills can be used. It's not as effective as other methods. Don't use this method as a first preference. Make sure to use the regular, consistent methods of contraception for better protection. Only in case if the other method is there is a break, or if the pills is forgotten, then we can use this method as a cover-up method, and it is effective only within the 5 days after the unprotected sex. It works by delaying or inhibiting ovulation. So once this emergency pill is used, it delays the ovulation. So the sperms, they survive in the female reproductive tract only for about 5 days. So if the ovulation is delayed or late or inhibited, those sperms die away and then the pregnancy can be avoided. Emergency contraception does not have any serious side effects, so it can be used safely. The most common types are Plan B, and the other type is after pill, next choice, 1 day dose. All these are the common type of the emergency contraceptive use, and they all contain levonorgestrel emergency contraceptive pills. Then methods of sterilization is a permanent method of contraception. It is the tubal ligation in females and vasectomy in the male. Vasectomy is the vas deferens is ligated. Vas deferens carry the sperms from the testes here. So if this is ligated, the passage through which the sperms move is blocked. Vas deferens or vasectomy is cheaper and lot safer procedure as compared to the tubal ligation, but it's less commonly used because males are less willing to have this procedure done as compared to the females. So vasectomy is tying and cutting away of the vas deferens. This is vas deferens. It's tied and cut to prevent or to avoid the passage. This prevent the passage or movement of the sperm. Here, these are the three types of methods done for tubal ligation. Either they are cauterized or they are burned away, they are tied and cut, or they are banded. All these three methods are used for tubal ligation. Now, the complications of sterilization technique, very, very important, is the decision should be well thought. This is the permanent method of contraception, so it's irreversible. If once done, it causes permanent sterilization, or pregnancy cannot be happen after that. So it should be well thought, well talked about. If no further pregnancies or children are required, then this should be done. Complications of anesthesia are there because it's a procedure done under anesthesia. Pulmonary embolism can happen and cause respiratory problems. Psychological effect is very common after this, because then the female start thinking that she cannot have children anymore, or if there is some complication or problem with the child they have already, there is so it can be a serious psychological issue. Vasectomy, or tying off the vas deferens, can lead to swelling and pain and bruising, is very common after the vasectomy. The best time to have tubal ligation is when the female has C-section for the delivery. If they think they should have a tubal ligation, at the same time when C-section is done, tubal ligation should be done, so to avoid any separate procedure, or to avoid any anesthesia later on, or to avoid any anesthetic complication. So at the time when C-section is done for delivery, tubal ligation can be done at the same time. So this concludes our section 5 of our lecture, topic methods of contraception, in which we talked about emergency contraception, which is used only in emergency after the sexual intercourse, which is unprotected. And then sterilization, which is the permanent method of contraception. So it should be very well thought and well talked about. If no further pregnancy is required, then we should go for the sterilization method of contraception. Thank you for watching sqadia.com.